Alrighty, well, good afternoon and welcome everybody. Thank you for joining us today. My name is Andrew Doffney, and I'm the Instruction and Outreach Librarian at the New Jersey State Library. And it's my pleasure to welcome back our presenter for today, who is Sally Zeifman-Kagan
Hi there.
from the Greater New Jersey chapter of the Alzheimer's Association. And today, Sally's going to be talking about the 10 warning signs of Alzheimer's. And what this is going to be kind of an overview of some of the symptoms you may want to look out for yourself or some loved ones that may indicate the onset of Alzheimer's or even dementia. The content that's going to be discussed today should not be construed as medical advice. This is for informational purposes only. And if you do experience any changes in your health, we encourage you to reach out to your medical professional and discuss it with them. So, before we jump into our presentation, I just have a few housekeeping items to go over. We will be taking your questions at the end of the program today, but you can submit them at any time using the Q&A or the chat feature in the Zoom dashboard. There will be a survey available at the end of the webinar, so if you have time, we ask you please complete the survey. We appreciate any and all feedback that you can give us. And if you want some more information about dementia and specifically Alzheimer's, you can visit the Alzheimer's Association's website at www.alz.org, and they have all sorts of resources on there, not only for individuals who might be suffering, but for caregivers, support groups, all sorts of things. So it's a really fantastic resource that I suggest everyone look at your leisure. And then one last thing I want to go over here is just a brief overview of the Zoom dashboard. This is what your dashboard should look like if you're using a PC or a Mac. If you're using a mobile device, the dashboard may look a little bit different, but all the features will still be there. In the bottom left-hand corner, you can check your audio settings. So if you're using an external listening device, like a headset or earbuds, you can check to make sure they're connected properly there. At any point during the presentation, if you do have an issue, you can hit the raise hand button. That'll alert me. I will send you a message in Zoom and hopefully be able to resolve any problems that you are having. And then, as I mentioned, if you do have questions, there's the Q&A and the chat buttons. You can send them to us and we'll be happy to address them at the end of the presentation. So that is everything that I have for you. So I'm going to turn it over to Sally now.
Okie dokie. Hi, everybody. It's so nice to have you all here today on this not so cold day as it was yesterday. So I hope you're all warmed up and ready to go. I am a community educator volunteer community educator with the Alzheimer's Association. And right now I'm going to try to get to share my PowerPoint. So let's see what we can do here. We'll go there and we'll say share. And we'll try to start the slideshow from the beginning. And here we go. Okay, everybody. So as I said, I'm a volunteer community educator with the Greater New Jersey chapter. I am a retired nurse. I was a school nurse for 25 years, and I decided to join and volunteer for the Alzheimer's Association because my mother passed away in 2015 after suffering with Alzheimer's. And I wanted to do a little something to honor her memory and to also bring an awareness to everybody about Alzheimer's and Alzheimer's Association. Today's program is, as Andrew said, is not medical advice for anyone, but it's to learn a little bit more about some of the warning signs of Alzheimer's and other dementias. And this is also for those who may have noticed memory or thinking changes in themselves or others. And given the alarming statistics that we see, over 7 million Americans have Alzheimer's disease, it's an important warnings that we should be looking for. And as Andrew said, we'll be taking Q&A at the end. You can put it into the chat box and we'll try to get to everybody's questions. So today, this is what we're going to be looking at. Today, we're going to explore some of the most common warning signs of Alzheimer's and also what normal aging might look like. Because sometimes people say, oh my gosh, is this a sign of dementia for me? So we'll go over some of those typical age-related memory changes. And we're going to discuss some of the tips for approaching someone who has some memory concerns and how to go about that in the most compassionate way that we can think of. Also, we're going to identify some of the tests that are available and assessments that are available today for the diagnostic process of finding out whether or not someone has dementia or Alzheimer's, and also to show you what the amazing services are available through the Alzheimer's Association. In this program today, we're going to meet a fictional AI family, so to speak, who is having some concerns. And we will be checking in with them throughout this program today. And we will please note that these experiences are probably common ones that people have. So it may not be exactly the same situation as everyone, but it kind of gives us a overview. So here's the Garcias. This is Mary, and she's a 73-year-old widow. She lives alone. She's a retired teacher, and she's always meticulously taken care of her home. Her daughter, who lives nearby, has recently noticed that things have changed. The laundry's piling up, the mail has been unopened, newspapers are scattered around the house. This is Lydia. She's the one that lives closest, just a few miles away, and she visits her mom frequently. And this is Patricia, and she lives in another state. She works long hours, and she's unable to come and visit frequently, and she has to rely on her sister, Lydia, to kind of tell her what's going on with mom. So Lydia is concerned about their mom's noticeable lack of tidiness. And so she's also continuously losing things. So she texts to Patricia, and this is what her text would look like. She said, I'm worried about mom. She keeps losing things, and the house is a mess. Now her sister, wants to say, well, maybe it's just, normal, a little forgetful with age. And her sister says, no, this is unlike her. Should we worry? Well, they have a friend, Dr. Soloway. Now, before I press on for Dr. Soloway, he is a real doctor and his specialty is Alzheimer's.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
Okay, that was Dr. Soloway. So we're all here today to learn a little bit more about Alzheimer's and dementia and identify some of the common warning signs. We're going to hear from a couple other experts today. First, we're going to hear from Dr. Heather Snyder, who's going to give us a very brief overview of what dementia and Alzheimer's is.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So as you see, Dr. Snyder pointed out that dementia is the general term for loss of memory and thinking skills that are serious enough to interfere with activities of daily living. So we also saw in her slide that there are many different types of dementia. So if you have Alzheimer's, you do have dementia, but not all dementia diagnosis means you have Alzheimer's. Now we're going to hear from Dr. Carrillo.
More than 100 years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
Lastly, we're going to hear from another expert about the importance of recognizing some of the warning signs.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things. But when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor to find out what you're dealing with. Some of the things that can look like Alzheimer's may be other treatable conditions. If it is Alzheimer's, you still want to know as early as possible, because that gives the person and the family time to plan, time to make decisions, and it also gives the person with the disease a voice and allows them to say what they want.
So I think, what Ruth just said is very important, why it's important to know what the warning signs are. And the Alzheimer's Association, as a leader in this area, developed a list of 10 warning signs to help people understand the difference between normal aging and common signs of possible dementia. This list is intended just to be a tool to help identify unusual changes in a person's memory, thinking, or behavior. And it's important to note that this list doesn't mean that if you have any of these things, that means that you have a diagnosis of Alzheimer's or dementia. These are simply the most common examples of changes experienced, and people may experience one or more of these signs in different areas and in different degrees. So let's explore each sign and what some typical age-related changes may be. So the first one, excuse me one moment. The first one is memory loss that disrupts daily life. So one of the most common signs of Alzheimer's, especially early on, is forgetting recently learned information, which we call short-term memory loss. And a typical age-related change is something like forgetting information, but remembering it later on. So you might forget that you had an appointment, but you do remember it later on. But in memory loss that disrupts your daily life, you will find the person that maybe asks you the same question over and over again, even though you knew that you had responded to it earlier, or they forget somebody's birthday that they always remembered. So those are some of the changes that might be concerning. The ones that are not concerning, or as if you forgot that you had the dentist appointment next week. The number 2 one is challenges in planning or solving problems. So what does this mean? Some people may experience new difficulties in developing plans or following through or concentrating. The typical age-related change is making occasional errors when you're managing bills or household finances. We're going to hear from John, who's living with dementia with Lewy bodies, about how he experienced his early warning sign.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking this, I was in my sleep, I was thinking about what I was anxious about, which was what I was trying to remember, which was I was trying to prepare, which I was trying to do. So it was really a vicious circle of, so I was able to control it a lot, so that people wouldn't see things, and there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
Takes a lot of energy for that. The third sign would be difficulty completing familiar tasks. So people living with dementia often find it hard to finish their daily tasks that they used to be able to do easily, such as driving to a familiar place or writing a grocery list or even remembering rules to their favorite game. The typical age-related change, though, would be occasionally needing help to use the microwave, the remote, how to get on this Zoom thing. And this means that, it's not a sign of dementia. This is a typical age-related form of forgetfulness. The difference between number two and number three is that number two was problem solving or planning in a new situation, like a new doctor's appointment, how to get there. This one, number three, refers to confusion with familiar or repeated situations, where problem solving really isn't required. It's all about remembering things like rules to a card game or how to get to the grocery store. We're going to hear from an expert on this sign.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So, for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
The fourth sign would be confusion with time or place. This is the person that's living with Alzheimer's or other dementia may lose track of the day, the season, or even the passage of time. They might have trouble understanding something if it's not currently happening, or they become confused about where they are or how they get there. And this actually becomes more profound and dramatic in the middle and late stages. We see that in people who are dressing in a summer dress and it's winter out, people who have gone outside in the cold and they're just not, they're wearing maybe a sweater or they don't know where they are and they're very confused. The typical age-related change could be getting confused about what day it is or when you scheduled an appointment, but figuring it out later. Now that I'm retired, sometimes I forget that every day feels like Sunday sometimes to me, but hopefully that doesn't mean that this is a warning sign for me. It means that I'm just enjoying life too much, perhaps. Number five is trouble understanding visual images and spatial relationships. This is very, very interesting because people with this kind of warning sign have trouble understanding visual images and spatial relationships. Some of the people who experience this have vision problems, which can lead to a difficulty with balancing, trouble reading, problems judging distance, and determining color and contrast, which can impact so many things like driving, getting in and out of the bathtub, going up and down stairs. And this can lead, of course, to accidental harm. And what we want to say about this one is that the vision may not be related to poor vision. It just may be related to a change in the brain, that the brain synapses that are sending the wrong signals out. So you may go to the doctor and they may say that the vision is 20/20 or 20/30, there should be no issues. But again, because of the dementia, it's changing the way that people are seeing things. Now, a typical age-related change to vision obviously could be cataracts. Well, let's hear from the expert again.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact, their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
Number six is new problems with words in speaking or writing. So people may have trouble following or joining a conversation. They may stop in the middle of a conversation and forget what they're talking about or continuously repeat themselves. They might also struggle with finding the right word or call things by the wrong name, or instead of saying the definition of not knowing the word, they'll say a definition of the word, like for pen, that righty thing, something like that. So they'll start using descriptive terms for that rather than saying the names of the actual item. We're going to hear from Phil about this.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, as an avid reader, as a reporter, as a writer. I struggle with them now.
And the typical age-related change would be sometimes just struggling to find the right word. Oh, and it looks like my program is having a little trouble and needs to respond. Oh my goodness. That would be awful. Andrew, any suggestions for this?
If it's just freezing, you can try to force quit it. Um, if you hold down alternate control and hit delete and bring up your
Yeah,
task manager, you can end the PowerPoint and then just
alternate delete
control, alternate, and delete all together.
all together. Here we go.
Yes. And then there should be an option for a task manager.
Nope. Oh, there we go. Task manager. Okay.
And then under PowerPoint, you should click on the PowerPoint and then hit end task.
I can find PowerPoint. And it says my 10 signs, but it doesn't say end task.
And towards the bottom of that window, it should say end task.
All the way at the bottom, bottom, bottom,
Uh,
bottom, bottom, bottom.
of the task manager, you should be able to click on. Oh, I'm sorry. It should be up towards the top ribbon. There should be a circle with a line through it that says end task.
Try to get back up there. Sorry, guys.
Should be at the top of the window.
Task manager.
And then it should say processes.
Yeah.
And then over to the right should
Okay,
be
I
end
got
task.
it. Yep. Okay.
And
Okay.
then just reload it.
All righty. God willing. Fingers crossed. Uh, is it there? No. I have to go to the file. See, guys, this is about technology and how absurd it can be sometimes. All righty. Thank you, Andrew. I'm going to go down to where I was, which I'll find when I get there to you. So now I'll go down here and share again, hopefully. Okay. And go to slideshow. If it would let me. No. Well, I don't know if it's going to let me do that. So I'm going to just wing it. I was on number 7. So let's see if I can go back to slideshow from current slide. All right, let's hope. Okay. So the 7th thing is misplacing things and the ability to retrace your steps. This sign often causes concern in people. And I want to clarify that this is not just about losing your keys, which we all do on occasion, but misplacing things from time to time. But then being able to retrace our steps, that's a normal age-related change. Like I know I put down my glasses somewhere. Let me think back, where did I last have them? And you find them. But a person that's living with dementia may lose things and not be able to recall when it was last seen or to identify the location where it was placed. Sometimes they may even put things in unusual places, like perhaps putting shoes in the refrigerator. So because of this lack of awareness of where they put things, sometimes the person living with dementia may grow increasingly suspicious of others and start accusing others of stealing and doing so more often as the disease progresses. So sometimes we see this a lot when we have people that come in as aides to help people that are living with dementia or cleaning people, and they say, she stole something from me. I know that I had it and then it's gone. Let's hear from an expert on this.
So some people wonder if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And one thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, they set their keys down in an unusual space. So there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
Number 8 would be decreased or poor judgment. So people may experience changes in judgment or decision making, such as using poor judgment when dealing with money or paying less attention to their hygiene or their grooming. And this is especially common in people that are living by themselves. We all make a bad decision once in a while, such as forgetting to get an oil change in our cars or some other typical age-related changes. But this is a little bit more serious than that. And this is also something why we have to be very mindful for people who are living with dementia, that they are just at risk for scammers falling prey to people who are trying to scam them. Let's hear from Teresa.
The way I kept my house, and all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office, because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was, because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
So the number 9 sign is withdrawal from work or social activities. As we age, sometimes we don't feel like hanging out with a lot of people or going to social engagements. However, someone who is living with dementia may start to lose their ability to follow a conversation or remember things that they should remember. So because of that, they might want to withdraw from those kinds of social engagements. They don't want to be embarrassed because they don't know these things, and they may lose confidence. We're going to hear from Dr. Soloway.
One of the most common changes, and early on, is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities, because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
And that leads us right into number 10, which is changes in mood and personality. People living with dementia may become confused, suspicious, depressed, fearful, or anxious because of all the other signs that they could possibly have. They might get easily upset, either at home or when they're out of a place that's familiar to them. When we age, however, it's normal to develop very specific ways of doing things, and we get maybe a little bit irritable when our routine is disrupted, but we don't see a big change in our mood or personality. We're going to hear from Dr. Soloway one more time.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated, or more impatient, or a little moody, or have a shorter fuse, or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
So now that we have gone through all these 10 warning signs, let's check in with the Garcias again. As we talked about earlier, Mary's daughters are concerned about the changes that they're observing in their mom, and they want to know, when is it time to see a doctor about the changes they've witnessed? So let's take a look at their conversation. Did you look at the warning signs info I sent? I did, but I still don't know. Mom's showing a couple signs, but not all the time. How do we know if it's serious enough to see a doctor? Well, here they go. They're relying on Dr. Soloway again. He's quite the guy.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check off all the boxes.
So that was a really wonderful recap that he gave us of the 10 warning signs. And it's important, again, to discuss any changes in memory, thinking, or behavior in either in yourself or someone else with a doctor. Because again, it may not be dementia, it may not be Alzheimer's, it may be something else altogether. And you owe it to you or to the person you care for to find out what that is. Our next topic is about early detection, and it's key that we pay attention to what's going on with our cognitive health and not dismiss any changes in ourselves or others because we think it's just normal aging. So any change that's unusual for your level of functioning, or if that's someone around you, it's cause for concern. And many times friends and family are the first to notice these changes in somebody's memories or behavior. And so in this next part, we're going to discuss why it's critical to address any observed changes early and seek answers from medical professionals. And sometimes the person that's exhibiting the symptoms isn't even aware or may not have any insight to know that they're experiencing changes, which is why having an outside perspective is critical. And this is especially important for people who live alone or far away from family and friends. Let's listen to Dr. Soloway.
It's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, in more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
Mary is a caregiver. Let's hear what she has to say.
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
So if you continue to observe changes, it's critical that you plan to take the next step. Have a conversation with that person or others close to them about what you've noticed. And this can be a really hard and uncomfortable conversation to have. And because of that, the Alzheimer's Association has developed a 10 helpful step program to help make addressing memory concerns less daunting and more productive and more compassionate. Let's take a look. The first one would be to start by assessing the situation. What changes in memory, thinking, or behavior do you see? What is the person doing that's causing your concern, or what are they not doing that they usually did that's causing your concern? For that, I would recommend to start keeping a log or a notebook. The next would be what else is going on? Many things can cause dementia-like symptoms. This is what I was referring to earlier. It could be medication interactions, a vitamin B deficiency, hearing loss, vision problems, hypertension, other brain issues. It may not necessarily be Alzheimer's, but you need to ask about what is going on. The third step is learn about the signs and symptoms and the benefits of early diagnosis. And being here, you've already taken the first step by joining us in this program. Do you notice any of the signs that we talked about in the person that you're concerned about or about yourself? Number 4, check to see if anyone else has noticed these changes that you're observing. Talk with friends and families if they haven't talked to you first. What, if any, changes have they noticed? Now you're going to have a conversation. So you're going to prepare for this conversation because this is difficult. Who should be the one to discuss the concerns with the person? It could be you, a trusted family member, a friend, or a combination of the two. And it's usually best to speak one-on-one so that the person doesn't feel threatened or ambushed by a whole lot of people coming in. But use what you know about the person to judge what approach might work best. Don't plan an intervention with the whole family. What's the best time and place to have that conversation? It's important to have it, obviously, as soon as possible if you have noticed a lot of these changes or some of these changes. So also you want to find out when is the person most comfortable. Sometimes people like to talk best and function better in the morning. Some people like to talk best after they've had dinner. Is it best to sit in the dining room, around the dining room table, or in the family room in a comfortable chair? What will you or the person having the conversation say? So you might want to build yourself a script, actually. Consider some of the following questions. I've noticed a change in you, and I'm concerned. Have you noticed this? Are you worried? How have you been feeling lately? You haven't seemed yourself. I noticed that you put the phone in the refrigerator, and it worried me. Has anything else like that happened? And I do want to mention at this point that the Alzheimer's Association offers several workshops to help prepare you for these conversations if you're interested. The first one is called Dementia Conversations, and the second one is Effective Communication Strategies. And you can find those at alz.org. The next one, step 8, would be to offer to go with the person to the doctor. It's always best to have 4 sets. 4 ears are better than 2. Sometimes also you may want to have a telehealth with the doctor, with the person, and maybe somebody who's out of town but is very close as well, an out-of-town relative that, would be helpful in sharing that information with. Now, number 9 is you might have to talk about this several times. Don't be discouraged if the first conversation's not as successful as you had hoped. It's a little overwhelming, right, to hear something like that. Write down for yourself how, perhaps some notes, how it went so you can prepare for the next conversation. Don't dismiss the changes, though, you're noticing simply because the person is reluctant or gets angry about having this conversation. It's overwhelming, and sometimes the person needs time to process. Then reach out for support. You can turn to the Alzheimer's Association, and we have a toll-free number, 24/7 helpline to talk with master's level clinicians who can provide reliable support and information. That number is, if we can put it in the chat later, is 1-800-272-3900. Finally, you want to see a doctor. Most people address their concerns about memory and thinking and behavior with their primary care physician. However, in some cases, the primary care physician may refer the person to a specialist for further evaluation, and they may suggest going to a neurologist, a neuropsychologist, a psychiatrist, a psychologist. Nothing to be afraid of, just wonderful to get as much information as you can. So we know what signs to look for now and how to approach that conversation. Now, what are the benefits from doing all this?
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue. There are a number of benefits in.
So paying attention to changes you notice in people, especially regarding memory, thinking, or behavior, is important for early detection. And if you do observe some of these behaviors, take action by having the conversation that we talked about. If you need to, consider using the 10-step approach to memory concerns that we discussed here. And there are a number of benefits to early detection, such as planning for the future, access to treatment options, and participation in clinical studies. This next part is about seeking a diagnosis. Let's take a look at what may be involved in the medical process to determine the cause of symptoms. And we're going to start by testing your knowledge. There is currently, true or false, currently no way to diagnose Alzheimer's disease. I'm going to give you a hint. The answer is false. There are a number of assessments now and tests that make it possible for healthcare professionals to diagnose Alzheimer's with a fairly high degree of certainty. However, determining the cause of the dementia can sometimes be more difficult. Here we're going to explore possible steps of the diagnostic process. Keep in mind as we talk about these steps that not everyone may be asked to undergo each one by their doctor, but some of the tests may include medical history, physical exam, screening for depression, an interview with a close companion to see what they may have noticed. Some of the tests that may be included are laboratory tests, mental cognitive status tests, which, by the way, Medicare offers that once every 5 years if you are on Medicare, brain imaging, and cerebral spinal fluid analysis. A spinal tap would be included with that. Sometimes we have genetic risk profiling. We can now have a new a blood test, lab test that FDA has approved for tau protein levels. So every day something new is coming out that helps us. So Mary's daughters are preparing for answers about their mom's changes in behavior. They wonder, do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia? Here is their conversation. Appointments have been going well. Mom's handling them okay. You think it's really dementia? Guess we don't know until we get a diagnosis, but let's ask Dr. Soloway if it could possibly be something else.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
So let's review what we just saw. The diagnostic process can vary from person to person. It depends on the person's specific situation and what the doctor feels the right course of action for that person. The diagnosis may be something other than Alzheimer's or another dementia. Why it's so important to investigate the cause of the symptoms. And also, we found that because of the stigma and misconceptions about Alzheimer's, which I hope are changing now, but this is really, it's been something that has been prevalent. Like nothing can be done. That's what they thought. It can deter some people from seeking a diagnosis. And getting information and support is also critical and is the next step. Let's learn a little bit more about what the Alzheimer's Association could offer. So if the diagnosis is Alzheimer's, what's next? Let's see what Mary's daughters, Lydia and Patricia, do. I called, but I got your voicemail. How'd it go? Call you later when I get home, but the diagnosis is early stage Alzheimer's. Oh no, what do we do now? Doc said that the Alzheimer's Association offers free resources. Some even help people live with the disease. We'll call soon, but I did leave the office with some hope. The Alzheimer's Association is in communities across the country, providing direct service to individuals and families facing this disease. We're leading the way to end Alzheimer's and all other dementia, and we are doing global research, driving risk reduction, early detection, and maximizing quality care and support. This is a great thing. Our vision is a world without Alzheimer's and all other dementias. The association's available. I think I had mentioned to you about their 24/7 hotline. And let's see what he has
I've had
to
a
say.
couple of phone calls that I've been able to make in to the call center when I've had a couple of quick questions that I wanted to ask. There's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
And imagine that this help is also available in 200 languages. ALZ.org, the website is fantastic, an amazing resource. I encourage anybody to go there.
When I went to the Alzheimer's Association website, which is ALZ.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, Where can I go for resources? Where can I go for help? What do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found a support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
It's an amazing thing too, because depending on where you live, they will send out a social worker to your home. They offer care consultations. They help you to strategize care plan solutions, things that you need to navigate as you enter this terrible, terrible time. They will help to provide you with resources. There's also on the website alzconnected.org, and that is a community of caregivers and people living with dementia, and even friends and families that have forums for questions and just support for one another. And then there is, in combination with AARP, there's a nationwide.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time or if I'm struggling to find some resource, that they will provide that to me.
So that is a specific site, alz.org/CRF, or Community Resource Finder. You go to that and you get a drop-down menu requesting your zip code. And when you put in your zip code, the page will populate with all the places around you that can provide some guidance for you. Also, you might be wondering, what can you do to help the Alzheimer's Association fight this terrible disease? So some of the things that you can do are volunteer, like I do, and you can go to the website. There's many different ways that you can volunteer. It's not just as a community educator, but being on some of the local committees that they have for the walks and for the longest day. So there's lots of opportunity for you there. If you're more into advocacy and you want to talk to the government about what you can do to help to raise awareness and raise funds, you could join the advocacy, altsimpact.org. I think Ruth had mentioned the trial match site that they have. This is where you can go on and match yourself. You don't have to have Alzheimer's to be joining a trial match. It's just to be able to help find people if you have Alzheimer's or dementia or don't have it, but they have clinical trials. And from the clinical trials and the clinical studies is where we're going to find that cure. The next would be Walk to End Alzheimer's. Many of you may have heard of it or seen it. We have so many communities that get out there. Usually it's in September and October where we have the walks where we raise money. It is quite, believe it or not, a joyful event that day. And then the longest day is another fundraising opportunity for the Alzheimer's Association, where you can raise funds and awareness on the summer solstice. And if you want to find out more information about that, you can go to alz.org, the longest day. And that is that.
All right, thank you so much, Sally. If anybody does have any questions, please feel free to send us using the chat or the Q&A. We'll be happy to address them. So the first question is, my husband doesn't seem to know that he has memory problems. It's pretty bad. Is that possible that they cannot even recognize it? They're nice about it, but they just don't recognize that they have it or dismiss it.
That it is very possible, and I think that that's why when I mentioned to keep a log, because they won't remember that, and it's not like you're showing, hey, look, here it is. This is exactly what happened, but it may show them that what you're saying is not out of the possibility of what you're talking about. So I would keep a log, but yes, they may not know that they're experiencing that.
Um, does non-Alzheimer's dementia have the same 10 warning signs, and are those other conditions treatable?
Again, it's something that you have to go to your doctor about. They have different assessment techniques for all of the different dementias. And Alzheimer's is significant in that it will have an amyloid plaque buildup in the brain, which they see on MRIs. In the new blood work lab results, they'll see a tau protein elevation, and in the cerebral spinal fluid as well, they'll see that. So they may not see that in the other types of dementia. And I apologize, I'm not familiar with some of the other tests, but we do know that there are different signs and symptoms that we see. I think best well known recently would be Bruce Willis, who has the frontal temporal lobe dementia, and we see that he's having a lot of speech difficulties. So again, you'd have to check with your doctor.
West Virginia University's Rockefeller Innovation Center was showcased on a new method to break through the blood-brain barrier. I don't know if you can speak on it, but has there been any progress in this new method becoming mainstream?
I can't speak on it. Again, you could go to alz.org and see, we are specific to what the Alzheimer's Association, what their research has shown and what they vetted as being appropriate for us to share. So I'm sorry, I can't speak to that.
Does someone who has suffered from a traumatic brain injury or accident suffer from some of these same symptoms?
Uh, Again, it could be, but we do know that suffering a traumatic brain injury can be something that can lead to Alzheimer's. It's one of the things that we have noted is, along with hypertension, diabetes, some of these are things that can be preludes to dementia and Alzheimer's.
Is it advisable to let them think of the correct answer when you're dealing with someone with Alzheimer's?
I'm not sure. I mean, I think you give people space and time to answer the question. I know when people are deep in the middle and late stages that you do want to allow them to believe what they believe. You don't want to correct them in their beliefs. You have to almost enter their world and not keep saying, no, that's not right. If as long as it's not harmful to them, you're only going to cause more confusion and perhaps anger and frustration by trying to correct them continuously. Anything else?
Nothing yet. I'll give it a few minutes in case
Okay.
people are typing.
Yeah.
Um, but anything you want to recap with?
Well, I just did want to mention that, it is the statistics are that there are 7 million Americans living with Alzheimer's, that over 11 million Americans are providing unpaid care for people with Alzheimer's disease, and that Alzheimer's disease kills more people than breast cancer and prostate cancer combined. So, it's out there, it's serious, it's things that we have to be concerned about. But there are some strategies to trying to maintain cognitive health, which I think is crucial and important for everybody to know. And there are things that, we've been talking about for ages, right? Physical health and exercise, making sure that you get some cardio routines going, make cognitively, make sure that you learn something, try to learn something new every day or every week, a new game, learn to play a musical instrument, put together some furniture from IKEA. That's a real brain buster, if you ask me. Another thing would be Mediterranean diet is recommended by the Alzheimer's Association, making sure that your diet is low in fat, increased in vegetables. The other thing that people may not be aware about is how important sleep hygiene is. It's a topic that people are talking about quite a lot now, but we need 6 to 8 hours of sleep. Our brain needs to kind of, as the rest of our body is settling down for the night, that's when our brain can look over the day and get rid of some of the things that it doesn't need anymore and recalibrate and kind of update itself like a iPhone might update itself. And so sleep is super important for that. And the last thing I would mention that is important for cognitive health is to be social. Have those times where you are with friends and with family and with people and engage in conversations. Uh, keep it going. That's real important.
All right. Um, my mother is 79 and was recently diagnosed with dementia. I've noticed her cognitive issues for years, and she's showing some of the signs we've talked about here, but her neurologist doesn't seem to be aggressive in treating the disease other than a couple medications. Are there any other treatments available to stall the disease, and what are my risk factors for developing it? That seems like a lot of medical advice that we need to be.
Yeah, yeah. I mean, I think that you do have to talk to the doctor about it. It sounds like he put her on, or he or she put her on some of the medications that have shown to be symptom relief or give you a little bit more sharpness cognitively. There are medications, IV infused medications for Alzheimer's, but you'd have to get that accurate diagnosis of Alzheimer's, and that she'd have to go through an MRI, some neuropsychology tests, maybe a spinal tap as well. So again, if she is seeing a neurologist, you're doing the best that you can right now. If you feel that the neurologist needs to be more aggressive, that's you have to ask. And for you, for your own concern, again, I know I have that concern as well. And so if it was not early onset dementia that your mom had or early onset Alzheimer's, I would say that it's a familial or environmental possibility. So again, the lifestyle changes or lifestyle strategies that I just mentioned about exercising, learning something new, watching your diet, getting enough sleep, hanging out with people, having a social life. Those are the best strategies that we have available to us right now.
Um, there was a trend that you were talking about a couple minutes ago, and somebody's asking, is that because we are living longer?
Oh, I think you mean the sleep
Yeah.
hygiene trend. Is it because we're living? No, no, I think it's just that researchers have realized how important sleep is to our cognitive health, to our brain health, and our physical health for our body. So it just seems to be that it came out in terms of maybe a lot of researchers were doing the same thing at the same time, but it's been impactful in the research studies.
My father will ask, what doctor am I seeing tomorrow? Usually I will ask leading questions to jog his memory. Is that a positive method?
Yes. Yeah. Yeah, I think so. Um, you know, again, you don't want him to get frustrated about it, but I think that any kind of jogging of memory is a helpful tool for them to have. Yes, even having a calendar that you have on the fridge that says when the appointments are, who they're with. I mean, that's helpful too. It's not like you're trying to fool them or pull something out from them, but it's helpful to have those kinds of memory joggers as well.
All right. Well, thank you so much, Sally. We really
Um,
appreciate
my
all the
pleasure.
information and you coming back and speaking with us. And again, thank you for everybody for attending today. As with anything medical, please reach out to the Alzheimer's Association for this or your medical professionals to find out what next steps are, what your risks are, treatment options, all of that. Um, so please take advantage of all those resources.
And wishing a happy holiday to everybody. And take care. Thank you so much for joining us today, too.
Yes. I mean, everybody be safe, be well, and hopefully we'll see you soon.